If you or someone you care about has just found out that you have high lipoprotein little a, also called LP little a, you're likely feeling confused, anxious, maybe even a little scared. Like, what does it mean? Are you going to have a heart attack? Is there a treatment for high LP little a? Well, if you have had an elevated LP little a and you're interested in proactively protecting your heart health, in this video, you're going to learn 10 critical things you need to know to give yourself the best possible chance at preventing, treating, and even reversing heart disease despite a high LP little a. So whether you feel overwhelmed, frustrated, or by the vague advice or determined to take action, you're in the right place. So the number one thing to know if you have high LP little a is, well, how did you get it? And the answer is it's mostly genetic. About 90% of LP little a is genetic. So, your lifestyle choices, while important in preventing heart disease, have little to no effect on high LP little a. The other thing to know about LP little a is that it is common. About 20% of people have a high LP little a. Now, what's high? It depends on the laboratory testing site. Generally over 50, some sites it's over 75 milligrams per deciliter of LP little a is considered elevated. The other thing, of course, about genetics is that if you have a high LP little a, you might consider suggesting either children or siblings of first-degree relatives get screened as well. This is an individual topic. Like, some people don't want to share with their family, or they're concerned the family won't take it well. I'll leave that up to you. But if I think in most cases it makes sense to share that with family if they're open to that. So the number two thing to know about high LP little a is, well, what does it mean? Well, you probably already know that it increases the risk for a heart attack. And that risk is about 2 to 3 times higher risk than people that have normal LP little a. But there's other things that go along with this as well. There's a higher risk for aortic valve stenosis. So the aortic valve is the main valve out of the heart between the left ventricle and the aorta. And that valve can get calcified, leading to stenosis or narrowing of the aortic valve. And that's higher risk if you have a high LP little a. The other thing to know about high LP little a is that it does increase the risk for stroke, for heart failure, and for blood clots as well. Number three thing to know, unfortunately, heart disease is shockingly common. So, we're talking about having a higher risk if you have high LP little a. Well, really everybody is at high risk at baseline. There's over 800,000 heart attacks each year in the United States. That's about 2,200 a day. Over 6,000 heart artery stents per year. In the US, about 1,600 per day. And if you look at a lifetime risk, about 60% of men, 56% of women will have either a heart attack, a stroke, heart failure, or die of heart disease in their lifetime. So, it's not much of an exaggeration if you're in a room with two other people to say 2 out of 3 of you are going to have heart attack, stroke, heart failure, or die of heart disease. Having high LP little a can increase that risk. But, that leads me to number 4 thing to know about high LP little a is you need to know what is your risk for heart disease. And the point here is that having a high LP little a does not mean you have a higher risk for heart disease. It just means you might have a higher risk. And I'll give you a quick example of this. I saw a woman a few months ago, 71 years of age. She had a very high LDL cholesterol, probably 95th percentile. LDL was over 180. She also had one of the highest LP little a's that I've ever seen, over 400. By all algorithms, she would be high risk for heart disease. But we did an extensive evaluation, carotid ultrasound. We also did a CT angiogram with plaque composition analysis, and she had no artery disease, 0 plaque. So the point of this is that, just knowing you have a high LP little a is not enough information to know your risk. The only way to know is imaging of your arteries. That could be an ultrasound of the carotid, the neck arteries, or imaging of your heart. Now, I would recommend considering a CT angiogram with plaque composition analysis, not just a calcium score, especially in younger people, like somebody say less than 50 years of age, because calcification is an end stage of artery disease and it doesn't detect soft plaque, which could be more common in a younger person. So if you really want to know your risk, CT angiogram with plaque composition analysis would be a tool that would give that information to you. Okay, so number 5 thing to know, effective treatment may be coming soon for high Lp(a). So right now we have medications that are PCSK9 antibodies. The trade names for these Repatha and Praluent. These lower Lp(a) by about 25% on average, although there's a lot of individual variation. I've had patients who have normalized their Lp(a) using these medications. I've had some that didn't change at all. Niacin, it variably lowers Lp(a). We don't use niacin much because the outcome data hasn't been it hasn't shown that it's effective when we can use niacin, or at least a long-acting niaspan, in combination with a statin. There wasn't any change in heart attacks. Like, we made the labs look better, but we didn't change outcomes. So niacin's not used as commonly. Really rarely, I've seen people have apheresis. It's basically like a dialysis for cholesterol. Very expensive, very time-consuming, but it will temporarily lower Lp(a), and there's a little bit of data about that. But here's the point I want to make here, is that there are at least 5 drugs that are in clinical trials that lower Lp(a) by more than 90%. But we don't know if they make just the labs look better or if they actually change outcomes, meaning heart attack risk, death risk. And those outcome studies are the first ones are supposed to be reported in 2026. So we're anxiously awaiting that. But here's number 6 thing to know if you have a high Lp(a). That does not mean that there's no treatment for high Lp(a) right now. In fact, we're still really good at preventing heart disease when we know the risk. And if you have a high Lp(a) and you have imaging or have had a heart attack, we know you do make artery disease. Aggressively treating and minimizing heart disease risk is effective. What do we mean by aggressively treating risk? Well, there's over 200 risk factors for heart disease, and all of them can contribute. All of them may be important. We know the things like, being physically active, eating a healthy diet, good blood pressure, insulin, good blood sugar, insulin, avoiding smoking and other toxins. All of those are critically important. But another aspect of that is also important is getting a really good cholesterol level. If you use LDL as your measure, certainly less than 70, it would be reasonable if you're a higher risk. But there's evidence that LDLs less than 20 may identify the lowest risk threshold for very high risk patients. We also could use ApoB here. That's a more accurate, although less commonly used. Accurate meaning more indicative of future risk. ApoB, in my very high risk patients, I shoot for an ApoB less than 35 in those people, if we can do that without causing them any harm. And just a little bit of a backstory, when I was at Mayo Clinic about 20 years ago, I was the prevention person there, and that was when Lp(a) was just coming out. So people were getting it checked, but they didn't know what to do with it. And so they'd send them to me. And I didn't know what to do with it either, but the only thing that made sense was, well, let's get everything optimal. Blood pressure, cholesterol, blood sugar, habits, lifestyle. Let's do everything and hope for the best. And what I've learned, over that 20 years is that's a really effective strategy. I have podcasts now with 2 of my patients, both high-end athletes, both in their mid-40s, having heart attacks despite being, one of them a podium finisher in Ironman competitions, the other one a national record holder in a running event. And both of them are alive and well and still my patients, here 15, 20 years later. So we do have options for treating risk, even though we may not yet have things that lower LP little a. So the number 7 thing to know, I alluded to this earlier, is do you have aortic valve stenosis? An echocardiogram, an ultrasound of your heart, would be the preferred way to assess the aortic valve. But a good clinical exam, meaning listening with a stethoscope, could also be adequate. Right now, we don't have any treatments that have been proven to slow the progression of aortic stenosis, although there's a little bit of data on the PCSK9 antibodies that they may slow that progression. But the main point is just knowing that if you have it, it may be something that we want to intervene on earlier, meaning it's become severe. We're not going to wait for symptoms. Potentially, we may want to do something about that. Now, number 8 thing to know is that you may be at higher risk of blood clots with a high LP little a. So a baby aspirin a day has been shown in some studies, as particularly with the genetic factors that lead to high LP little a. There may be a slight benefit to preventing blood clots in those people. But I will also say that this is still a little bit of a murky area. Aspirin, baby aspirin in general, and primary prevention, meaning somebody who's not had a heart attack or stent or bypass surgery or stroke, is probably a net negative, meaning there's a little risk of increased bleeding, a little risk or a little benefit of preventing heart attack, but the bleeding risk outweighs the benefit of the heart attack in most people with primary prevention. However, if you have high LP little a, it may make sense if you're low risk for bleeding issues to take a baby aspirin, and definitely talk to your physician about that. The number 9 thing to know is you likely have more control than you think. And as I said earlier, and I'm going to say this a lot, over 90% of heart disease is preventable and even reversible, even if you have a high LP little a. And I can understand why you'd say, well, how can heart disease be 90% preventable when it's the number 1 cause of death? I mean, you all remember the statistics that I just said is, 8,000 heart attacks a year. Like, how could 90% of that be preventable? Well, I'll tell you why. 3 reasons why a mostly preventable disease causes almost 2,000 premature deaths every day in the United States. Reason number 1, healthcare isn't built to reverse disease. We all know this. It's reactive, built to monitor, manage, and medicate, not to prevent and treat. Number 2, healthcare treats symptoms, but not root causes. It doesn't answer questions like, well, why do I have this? Or how do I stop this? And number 3, and this is just the harsh reality, there's a lot of money in sick people, and your health is not the highest priority of the insurance companies, the pharmaceutical companies, large healthcare corporations, private equity. They're there, that's healthcare, but their main priority is not your health. So that brings me to the number 10 thing you need to know. I'm no longer willing to accept that low quality healthcare. That's why I left my dream job and started the practice at HealthspanMD. And if you are no longer willing to accept low quality healthcare, and when it comes to your heart disease, prevention, LP little a, and if you're looking for an expert team to show you how to decrease your risk of heart disease by greater than 90%, well, that's what we do in my practice at HealthspanMD. So I started the heart longevity program at HealthspanMD for people with a high LP little a who want to eliminate heart disease through a comprehensive precision approach, advanced technology, and exceptional healthcare that gets results. Let me just tell you how the program works and the structure of this. So the heart longevity assessment does involve advanced testing. But we're not doing that just to check boxes. We're doing that so that we know exactly where you stand, where your opportunities are, where your risks are. We do CT angiograms with plaque composition analysis in people that have an indication for that. But we also do ultrasound screening of the heart, the carotid arteries, the abdominal aorta, advanced lab assessment, for hormones, cholesterol, metabolism, inflammation, among others. And we also do a DEXA scan for body composition. So we know muscle mass, visceral fat, body fat percentage. Incredibly valuable tools and identify people that are at risk for, or where their opportunities are. All the patients, of course, get me, a preventive cardiologist. I've spent my career focused on preventing heart disease. I've been a board certified cardiologist for 20 years. I spent most of my time at Mayo Clinic. I've been a professor of medicine. I've done research. I've spoke all over the world, mostly about preventing heart disease. The point of this is that this is something that I dedicated my career to, my mission, my passion. It's pretty unlikely, if your goal is preventing heart disease, that you have a situation that I have not seen and not helped people with. But I also realize that heart longevity requires more than just a cardiologist. It requires a team of experts like what we have at HealthspanMD, that includes a physical therapist, exercise physiologist, dietitian, mental health specialist, and an exceptional team of longevity health coaches. We also pay attention to health outside of the heart because it's all interrelated. I know medicine could be in a silo, but all your health, your kidney, your liver, inflammation, all that health is critically important to your heart health as well. And that's why all of our patients see internal medicine specialists, Dr. Lisa Hurst, or consultation, ongoing primary care if they want that, to optimize hormones, inflammation, metabolism, prevention, and early detection. Dr. Hurst is from Michigan, University of Michigan. She spent over 25 years at Mayo Clinic as well. So the heart longevity assessment is where everything starts. That's our upfront evaluation to just know everything about your risk and any potential threats and opportunities. And as part of that, we know a strong body fuels a strong heart. That's why everybody gets a strength, stability, and functional movement assessment with VALD technology. This is really cool quantitative tools for assessing functional movement. We do VO2 testing because fitness is one of the most powerful predictors of mortality. And when we do lean muscle assessment with DEXA technology as well, so we understand your opportunities to feel and look younger while protecting your heart. But we also realize that a strong heart requires a sharp mind, and that's why we do advanced cognitive assessment with ViewMind NeuroScan eye tracking technology. Super cool tool. It takes less than 15 minutes to do a cognitive assessment with this. Really good data on how it correlates with longer cognitive testing. Much more powerful, though. It's very effective at predicting future risks. So the idea here is that we can use this to take advantage of the opportunities to keep your mind sharp while we're preventing heart disease as well. Now, the HealthSpan Heart Longevity Assessment, it's not just a checkup. I mean, at the end, we want you to know what's wrong, why, and how are we going to solve it. So the timeline of the heart longevity assessment at HealthspanMD is this. First, there's the launch. We do the heart longevity assessment. We discover those hidden opportunities, threats in the week one with your team of experts. And then we create your strategy and tactics over the next 2 weeks. We have experience. We're going to be your experienced strategists in optimizing your health. But then the real magic occurs. That's the ongoing connection and support that's throughout the year. We have access to your physicians, your expert team, your dedicated health coach, and we're working to continually make progress, but also serve as that health security system, like monitoring to make sure that there's not any surprises, that we're well situated to identify things early before they become untreatable or more challenging to treat. And then repeat that annual assessment every year indefinitely, just keeping with the goal to keep getting better and keep getting younger. So this is a systems approach that turns wishful thinking into reality. This isn't guesswork. This is a data-driven system approach to prevent, treat, and reverse heart disease. So, one of the questions you may ask is why now? Well, I warned you I'm going to bring this up again because 90% of heart disease is preventable and even reversible, but unfortunately, many people are waiting too long. As we mentioned, 2,200 heart attacks, almost 2,000 heart-related deaths, 1,000 sudden cardiac deaths every day in the United States because people were waiting too long to take control. So if you're no longer willing to accept the default option of waiting, I would suggest to schedule your call by going to healthspanMD.com/call. You'll get to meet with our new patient advisor, Rob. There's no pressure. This is just a real conversation to see if we're the right fit. No prep needed. Just bring your story and we'll take it from there. At HealthspanMD, we believe your best years are still ahead. Years full of energy, purpose, clarity, and peace of mind. What if your next decade could be your best one yet?